From Omaha Spine and Sport. We are on YouTube this time. Sometimes we do the Facebook Live, trying YouTube this week. Today it's a physical medicine public service announcement. We want to get this out to the masses because we see it in the clinic and we get humored by it, but it's also a little frustrating. We just want to say this is a foam roller. A lot of people foam roll. It's a great self-treatment for mobility and soft tissue restrictions. But one thing it's not very effective at is foam rolling of the IT band. So if you have any, the IT band sits at the lateral knee. Any common in runners, actually 25% of runners will get knee pain within the year, and 42% of running injuries are actually at the knee. So we kind of have the IT band syndrome, which is lateral knee, and then the patellofemoral joint syndrome, which is more the anterior knee. So public service announcement, do not foam roll your IT band, specifically at the knee. You're probably creating more harm than good. You're definitely not doing what you probably think you're doing or what you've been told. So we're going to kind of hop into that and kind of explain why you shouldn't do it, and then in turn what you can do besides this, okay?
Yeah, like Jay said, we see a fair amount of runners here, so we get the foam rolling story quite often here. And we'll actually see people that foam roll so much that when we actually test for IT band tightness, it's not the IT band that's tight anymore. It's something else. It's some other hip flexor that's taken over. And it's true, you can stretch too much and you can roll too much. You can actually loosen structures up to a point where they're almost unstable. And so I've seen it, a fair amount over my career in 13 years, where you actually can do too much stretching, too much foam rolling, and create some other issues just because of just like any other overuse problem. If you overdo anything, everything in moderation is kind of the goal. If you overdo anything, it can create other problems. And so we're going to talk about what you should do probably instead of doing the foam roller and the IT band. It's okay to foam roll once in a while, especially if you have like an initial onset of lateral knee pain, so knee pain on the outside here. But realize that IT band is tight because of some other reason. And we see it a lot in runners because runners stay in the front, right in front of them. It's called the sagittal plane. They just stay in one direction. And that doesn't engage the glutes, our lateral stabilizers. And what's more important about the glutes, the glute medius, the glute maximus, is how it controls the femur and how it controls that rotation of the femur. And if we don't use the glutes, then our brain just picks another muscle to try to help compensate for that. And it usually does so by location. And one of the muscles that's the closest to the glutes is this little tiny triangular shaped muscle called the tensor fasciae lata, a little tiny itty bitty muscle that ties into the IT band. And the IT band is a big thick band of fascia. So if you think about like the gristle on your chicken, or that lining between the chicken pieces on the drumstick, that's what the IT band is. It's the biggest layer of fascia that we have in our body. It's very thick. But it doesn't have any contractile elements, meaning it can't contract on its own. So it has to be being pulled on from some other structure, and that structure is the tensor fasciae lata muscle. So obviously there's things we can do for that. We can do, for the muscle, we can do myofascial release. We can do like the instrument assisted stuff for the IT band. All of that is great, but it's just symptom control, because what we need to do is turn that muscle off and engage the right muscles so that the femur isn't spinning inside or creating these frontal plane loads in the knee that stresses the IT band. And so ultimately what we want to do is we actually want to strengthen the glutes so that we turn these other muscles off and take that tension away from the IT band.
Right, so if you've had that IT band syndrome that's been going on and on and on, and you continue to do this, I think I posted something not too long from our Facebook group, if this hasn't fixed you by now, it's probably not going to, okay? Like, this is very acute care, long-term mobility restrictions. This is probably a better option, kind of getting into the proximal rehabilitation of the hip. The job of the IT band is it's a lateral stabilizer at the knee. It prevents a lot of the valgus collapse of the femoral adduction, where it's kind of going towards midline like this, as well as tibial internal rotation. So what you see in somebody that has some eccentric weakness at the hip is you actually see excessive amounts of femoral adduction and then tibial internal rotation. And what that amounts to is it places a lot of strain within that tensor fascia lata and the IT band. So essentially you can just think of like this little traction going on. And we used to think like the sagittal plane thing happened, like the IT band was actually flipping back and forth over the lateral femoral condyle. And what we know now is that it's more like 3 different bands that kind of sit here, and based off the amount of knee flexion that you have, it tenses one band. So it kind of gives that look, but it's not actually happening. Also, they used to think there's a bursa there, which that's no longer the case either. So we dissected fresh cadavers, and they never found bursa. There's an innervated fat. Yeah, weed in it. We don't have that capability here in the office.
We do things.
And they found a fat pad underneath there that's innervated, and that's kind of what happens or creates that compression. And that's why I said it could be doing more harm than good, is because if you're foam rolling, you're just adding more compression. It's just a compensation. Like Corey said, it just picks something that's in the area, and it's that much smaller muscle that's not quite as good as the job of stabilizing the knee as like the glutes and the glute medius, glute maximus. So what we kind of try to do is, we'll see it in our assessment in like a 6-inch step down, a modified Thomas. You'll see, this is more for the students, but you'll see like the foot kind of go out like that. And we know, and you can even palpate the band, and it's tender and it's tight. So what we can do is we're trying to turn on the glutes, activate the glutes, so this muscle can relax. We can take some strain off of it. So if you're completely obsessed with your foam roller, you'd be better off foam rolling more the hip, foam rolling that muscle up here to kind of try to decrease the strain down the leg.
Yep, exactly. And that's, I mean, if you're going to do that, that's probably the best place to start, is to always kind of start more proximally, which means closer to like the pelvis and the core, things that are closer to your main joints. That's where you need to start with a lot of these things. Realizing that ultimately what's really going to help you the most is if you strengthen the glutes. And we do this eccentrically, which I know it's a fancy word, but that's the phase of the muscle that lengthens under contraction. And so we do a lot of the initial contractions and then like slow returns to start, or slow controlled movements through a range of motion, because it's not so much like strength, it's more the endurance and turning on the right muscles at the right time. One of the best studies ever done on the IT band was one done by Fredrickson, where they took 26 runners that had IT band syndrome, and all they did was give them glute strengthening exercises for 6 weeks, and 24 of them improved to the point where they had no symptoms. They didn't
completely resolved.
Yeah, no foam rolling, no manual therapy, which we're going to do here. We're going to hopefully get that done sooner than 6 weeks. But it just goes to show that if you strengthen the right muscles, it turns off the other ones, and it takes all that tension out of the IT band. They didn't do anything else other than glute strengthening for 6 weeks, and 24 of those 26 runners improved to symptom free. So that just proves what we already know, is that if you can turn on the right muscles and turn off the wrong ones, then you're not only are you going to improve symptomatically, but you're going to be able to maintain that improvement for a lot longer. So if you're a runner, I highly encourage you to cross train throughout the week, at least twice a week. If you're running 4 or 5 times a week, pick 2 days in there where you don't run and you do glute strengthening exercises, and work that into some sort of routine, because it's really important for not only preventing these injuries or recovering from these injuries, but to prevent these injuries reoccurring. Because if that's the biggest thing with runners, once you have an injury, then the likelihood of that coming back skyrockets as far as what the stats show us. So do these things preventatively, and you won't have to worry about a lot of these things.
I think what I picked up on, Corey, is the endurance factor is key, because you see it consistently. Like you'll see, 2 miles in, and then that's when it bothers me. And obviously everybody's kind of different depending on what type of runner you are, where you're running, what your training level is. But we see it like 2-3 miles in, it's like now that's when it starts to bother me. And like that's because your glutes do fatigue, and you are able to control that knee for a while, but then once you start getting up there, then your form probably goes to crap, and you got bigger problems than the knee. So what we try to do really is just really focus on kind of developing this unique plan for you, like that includes manipulation, it includes soft tissue, but also gets you involved. Like the cross training is super important. So we wanted to do this video on YouTube because we have a couple exercises on our YouTube channel, like the clams is a great one. We get the studies show that you get really good EMG. So if we're measuring the muscle activity, that it targets the right muscles. And it's not the most fun exercise in the world, but it's a great place to start for a lot of people because it's eccentric and it's closed chain, which applies greatly for runners.
And you get one of these cool little bands.
And you get your official Omaha Spine and Sport Perform Better sweet stretchy band. And we have different colors as you progress through the exercises. This one's yellow. This is generally where we start with people. Anything else to add before we kind of sign off here?
No, just again, we're going to check everything. We're not going to just give you exercise here. We're going to do, we're going to look at the foot and ankle. We're going to look at the SI joint. We're not going to ignore the fact that you have IT band pain, obviously. So we're going to treat those things, but we ultimately want to get you to a place to where, we're not just treating pain, because that's not really what our goal is here, is to obviously get you out of pain, but so that you can enjoy your activities longer, and you can keep doing them while we're doing the treatments here. But ultimately we want to give you the right things, so that got a good conscience. We want you to be doing the right things and not just putting the Band-Aid over top of the IT band. So that's our goal here, is to keep you doing the things that you love, and so that we don't take anything away from you. You continue to do the things you want to do, and we're just here to help you. So if you have any questions, feel free to call the office. You can visit the website. We're on Facebook.
You can comment on this YouTube video and we will comment back. That way it's very structured. Otherwise, you can just call the office, 402-933-4447.
See ya.